I think one of the successes of FAO's work on One Health is based on what we can do together with partners, including the World Health Organization or the World Organization for Animal Health, the OIE. One such example that I can share with you is our commitment on rabies and dog population management. For post-exposure prophylaxis for rabies after a dog bite, that injection that is given to a human because of potential exposure, I could have possibly vaccinated 500 dogs for the same cost of that PEP, post-exposure prophylaxis. So if we can tackle the problem at source, then I won't have the spillover event to humans. So with rabies and dog population management, making sure that people that own dogs know how to take care of them, offering or celebrating World Rabies Day on the 28th of September of each year. These are important communication things that we can do together, very much on the One Health line. Another example could very well be something a bit more scientific, what we call the four-way linking that we established with the World Health Organization, which is where the public health epidemiologists and the public health laboratories, diagnostic laboratories, would share information with the epidemiology units of the veterinary services, with the veterinary diagnostic labs. And shortly thereafter, the OIE came to participate with this, what we call four-way linking. We could take this to another level and call it six-way linking, should we bring in wildlife or the environment or natural resource units, and we hope to do so soon. A more recent example is something that we're living these weeks, this January, February of this year, is the outbreak of peste petit ruminant, a disease of sheep and goats, doesn't affect humans, that has entered into Mongolia. And the spillover of this viral disease from sheep and goats into the saiga population. Now, saigas are an endangered ruminant species known in that part of Central Asia, and with very high mortalities, probably decimating 50% of the population of Mongolia. This One Health approach of bringing in veterinarians, wildlife specialists, some of the pastoralists on the Mongolian steppes is very, very important to be able to protect these wildlife species as well as the domestic animals through its vaccination campaigns. If we look at national health systems, and if we look at public health, I would argue that public health is much bigger than the Ministry of Health. It bleeds over into other aspects, certainly food and agriculture, natural resources, environment, commerce, education. All that should be part of really a bigger vision of public health. If we look at the finances, however, and comparing the Ministry of Health and the Ministry of Agriculture, where usually is where the veterinary services are located, the veterinary services, if we do believe in tackling the disease at source or the threat at source, we need to support more, strengthen more that veterinary services, the veterinary systems in place. In many countries, it's harder to get into the veterinary faculty than it is to get into the medical school. Having a PhD in epidemiology and public health and being a veterinarian, I think I feel very comfortable speaking to both groups. But I think that there's a chip on the shoulder, or there's a lack of financing of the weakest link of the health systems. And I would argue that that is environmental health or animal health in order to protect directly human health. One of the most important aspects is having these interviews or videos like the one that the World Health Organization is doing to communicate this better to stakeholders or other interested parties. And One Health should not begin when we hold a veterinary degree or a physician's degree or an agronomist degree. It probably should happen sooner at secondary school level, where we start talking about One Health, where we don't necessarily separate humans from the other terrestrial mammals. Teach our children or our classes about that shared health and that shared threat and that shared responsibility. So when that individual becomes an adolescent or goes to the university and graduates as an adult, these ideas are already embedded in their minds, and they become better professionals for that. I think an open mind, rather than one has already reached the pinnacle of that person's academic exposure. If we have a more open mind, like a parachute, it works better when it's open. I think these are opportunities to change the future by bringing One Health down to elementary or secondary school. One aspect that we can do today with those that have already reached the pinnacle of their careers is improve the communication, show the relationship, whether it's rabies and dog population management, so that less funds have to be put into post-exposure prophylaxis. Why? Because the dogs are vaccinated, or because rabies has been eliminated from this particular country or region. So I think actions by doing, by planning together, by talking together, by sharing resources together, but it has to be done if we really want to be more preventive. For One Health to work, we have to fix the gaps of the weakest links. And in this particular case, if we're talking about zoonotic diseases or high impact diseases, the veterinary systems are weak around the world and need strengthening. A second key point is communication, 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 and not necessarily in that order. A third point that I would like to make is the mind, like a parachute, works best when it's open. And I think that to tackle the problems such as health, poverty, hunger, requires many disciplines coming together, sharing ideas to improve people's lives on the ground. I think One Health is, 1 + 1 = 3. So it's more than the parts that we bring together. That synergy, that's required.